Welcome back to the Healthier Life YouTube channel. I am Dr. James. Today, we're excited to share with you the top best remedy for vertigo that can help you find relief and regain your balance. Whether you're dealing with occasional dizzy spells or persistent vertigo, these remedies can make a real difference in managing your symptoms. Before we dive into the topic of the day, what is vertigo? What are the symptoms of vertigo? What are the causes of vertigo? Vertigo is a symptom characterized by a false sense of spinning or movement, often described as a spinning, tilting, or swaying sensation. It is commonly associated with dizziness and can be accompanied by other symptoms such as nausea, vomiting, sweating, and difficulty maintaining balance. Vertigo is not a condition itself but rather a symptom of an underlying problem. It is typically caused by disturbances in the inner ear or the vestibular system, which is responsible for maintaining balance and spatial orientation. The inner ear contains structures called semicircular canals and otolith organs, which detect the movement of your head and help transmit signals to the brain about your position and motion. A disruption or dysfunction in the inner ear or the signal sent to the brain can lead to vertigo. The symptoms of vertigo can vary depending on the underlying cause and the individual experiencing them. Symptoms may include dizziness, feeling lightheaded, unsteady, or off balance. 2. Abnormal eye movements. Uncontrolled eye movements, known as nystagmus, can occur during vertigo episodes. The eyes may oscillate or jerk involuntarily. 3. Sensitivity to motion. Increased sensitivity to movements, such as turning the head or changing body positions, which can trigger or worsen vertigo symptoms. IV. Loss of balance. Difficulty maintaining balance, leading to unsteadiness and a feeling of being off-center. Versus sweating and pallor. Some individuals may experience sweating, clamminess, or a pale appearance during vertigo episodes. V. Hearing changes. In some cases, vertigo may be accompanied by hearing loss or ringing in the ears, tinnitus. 7. Nausea and vomiting. Many people with vertigo experience nausea and may sometimes vomit, especially during severe episodes. It's important to note that these symptoms can vary in intensity and duration. Some people may experience occasional, brief episodes of vertigo, while others may have more persistent or recurrent symptoms. It's important to note that these symptoms can vary in intensity and duration. Some people may experience occasional, brief episodes of vertigo, while others may have more persistent or recurrent symptoms. If you're experiencing any of these symptoms, it's recommended to consult with a healthcare professional, such as an ear, nose, and throat (ENT) specialist or a neurologist, for an accurate diagnosis and appropriate treatment. They can assess your symptoms, conduct any necessary tests, and help determine the underlying cause of your vertigo. Now let's dive into the top best remedy for vertigo. When it comes to treating vertigo, the approach varies depending on the underlying cause. Here are some common causes of vertigo and their respective remedies. 1. Benign paroxysmal positional vertigo, BPPV. BPPV occurs when tiny calcium crystals in the inner ear become dislodged and float into the semicircular canals, leading to vertigo. The Epley maneuver, also known as the canalith repositioning procedure, is a therapeutic technique used to treat this specific type of vertigo called benign paroxysmal positional vertigo, BPPV. BPPV. The Epley maneuver aims to reposition these dislodged crystals, allowing them to move out of the semicircular canals and into an area of the inner ear where they will not cause symptoms. This maneuver can help alleviate the vertigo and dizziness associated with BPPV. 2. Vestibular neuritis. This condition involves inflammation of the vestibular nerve, usually caused by a viral infection. In such cases, medications like antihistamines, antivirals, and anti-inflammatory drugs may be prescribed to manage the symptoms. Additionally, vestibular rehabilitation exercises can help retrain the brain to compensate for vestibular dysfunction. 3. Meniere's disease. Meniere's disease is characterized by recurring episodes of vertigo, hearing loss, tinnitus, ringing in the ears, and a feeling of fullness in the affected ear. Treatment for Meniere's disease often includes lifestyle changes, such as reducing salt intake and avoiding triggers, medications to manage symptoms, such as diuretics and anti-nausea medications, and in severe cases, surgical interventions may be considered. 4. Vestibular migraine. Migraine-associated vertigo, also known as vestibular migraine, is treated similarly to regular migraines. Lifestyle modifications, identifying and avoiding triggers, and medications such as beta blockers, calcium channel blockers, and anti-epileptic drugs may be prescribed to prevent or alleviate symptoms. 5. Medication-induced vertigo. Certain medications, such as those used for high blood pressure or as a side effect of some antibiotics, can cause dizziness and vertigo. Diagnosing the cause of vertigo often involves a comprehensive medical history, physical examination, and sometimes additional tests like hearing tests, imaging studies, such as MRI, or specific balance assessments. Treatment for vertigo depends on the underlying cause. It may involve medications to manage symptoms, vestibular rehabilitation exercises to improve balance and reduce symptoms, dietary changes, and lifestyle modifications. In some cases, surgical procedures or interventions may be considered if conservative treatments are ineffective. And that's a wrap on our video discussing the top best remedies for vertigo. We hope you found the information helpful and insightful. Remember, finding the right remedy for your vertigo symptoms is crucial for improving your quality of life and regaining control. Remember, everyone's experience with vertigo is unique, so it's crucial to find the right combination of remedies that work best for you. If you haven't already, be sure to consult with a healthcare professional who can provide individualized recommendations tailored to your specific needs. Thank you for watching. Make sure you subscribe to our channel for more informative content on a healthier life. We appreciate your support and engagement. If you have any questions or suggestions for future videos, please leave them in the comments below. Stay tuned for more exciting content, and we'll see you in our next video. Take care and stay healthy.